Myself, Dr. Dipak Roy Chowdhury, Orthopaedic Surgeon, Consultant Orthopaedic Surgeon at Kothari Hospital, Kolkata. Now, in orthopedics, generally it is seen that the joint pain or the osteoarthritis is most common among the people. This osteoarthritis actually occurs due to degeneration of the synovial joints. Mostly in our country, mostly the knee. Also, there is osteoarthritis in the hip and shoulder too. Even in wrist also it is seen. But as because knee being the weight bearing joint, so it causes more problem than other non-weight bearing joints. Ankle also do have osteoarthritis. However, most of the patients suffers mostly with the osteoarthritis of the knee, and they need advice for the osteoarthritis of the knee. It is the most common thing. Now, osteoarthritis develops, it is a primary osteoarthritis. It develops because, number one, mostly in the females, because menopause and unscientific use of the knee joints. In our society, the women are supposed to sit on the floor for their domestic activities, and they need to walk and stand for quite a long time for their activities. And that is the basic reason causing the degeneration and the other problems. Moreover, body weight is another thing. In our cases, usually the heavy body weight after the age of 40, that also adds this degeneration changes. Now, the commonest problem is the pain that interferes with the walking, using stairs, sitting on the floor, sitting square-legged, etc., which are the common thing used or utilized by the patients in our society. And for that, what they have to do, primarily they must try to prevent this excessive degeneration of the joint. Degeneration cannot be prevented because it's a lifetime after the age it will degenerate, but excessive degeneration can be prevented. That means they have to follow few activities in such a way that it does not cause more pressure on the joints and develop the degeneration. Number one, try to reduce the body weight. Secondly, avoid sitting on the floor till there is no problem in the joints. When she develops or the person develops problem in the joints during working, they should take rest and do the work afterwards. And secondly, the knee joint in advanced osteoarthritis, it bends, it bows like, so in those cases, walking is very difficult. And if the patient goes outside, then they can use a stick, walking stick, that will definitely reduce the pain. Too much using of stairs should be restricted. Then local heat can help a lot. That can be done in addition to some medicines. To relieve the pain, they can take analgesic, but analgesic is not the treatment of osteoarthritis. Right. Analgesic reduces the pain feeling, but it cannot cure the progression of the degeneration of the cartilage. So I think analgesic to be taken only if the pain is so severe that it interferes with the daily activities, then only. Otherwise, following the do's and do nots, doing exercises definitely, that means increasing the power of the quadriceps, and using some chondroprotective medicines. There are so many chondroprotective medicines available, but nowadays the latest the thing is the type 2 collagen that gives a good result for prevention of the cartilage, and that can reduce the pain definitely. But just only taking the medicine will not help in any way. In addition to the medicine, the following do's and do nots and the exercise definitely will help to come out of the majority of major problem and the pain, and to carry on daily activities. Now, if the condition following this, if the condition goes such worse that even the daily activities is not possible because of the pain, then the patient can think of replacement surgery. Otherwise, till they can carry on with these activities, with these norms, they can carry on before the replacement surgery. Thank you.